We were able to form an organization that would never have been able to be formed in any other way. We were able to put together a team of people to perform roles that frankly would not have been funded in any other way.
Our A team consists of Dr. Andrew Scheiber, who is our technical advisor. He is a clinician working in the healthcare field.
I provide some technical advice, technical support, capacity building for a range of organizations working around drug policy and harm reduction. And I'm also engaged in global fund processes on the country coordinating mechanism. And I'm a strong ally of people who use drugs.
Professor Monique Marks, who's from Durban University of Technology, she was very instrumental in starting the first opiate substitution therapy. Charity Monitoring is our parliamentary officer. She does high-level engagements around drug policy together with the Central Drug Authority. Sean Shelley is the founder and is very much hands-on in terms of the overall plan and ensuring that we're all working together towards the collective vision. And myself, I'm Julie. I do a lot of the administrative work as well as working specifically on women who use drugs, sexual reproductive health care rights, human rights and harm reduction training around South Africa.
We've seen how unrestricted funding can really be leveraged to achieve things that people didn't think possible and to do the work that brings about long-term social change.
It has taken us a long time to build the correct team of people who are making a difference, who are shifting lives, who are making changes on the ground. Unfortunately, we no longer have Open Society Foundation funding. We need to access more funding, more unrestricted funding.
The top achievements are the establishment of SANPUD, the South African Network of People Who Use Drugs. We've managed to develop the Contemplation group. We've held the South African Drug Policy Week, and that's morphed into the African Policy Week. We've also established South Africa's first low-threshold opioid substitution therapy and worked on the pricing of methadone and the availability of methadone. We've published more than 50 journal articles and conducted more than 300 television and radio interviews. The funding also enabled me to work on developing the community-oriented substance use program in the city of Tshwane with the University of Pretoria. Most importantly, we've put together a team of people who will continue to operate within the space and make changes in the world we live in. We are incredibly appreciative to Open Society Foundation. Without Open Society Foundations and the people that work there, none of this would have been possible. And the funding certainly enabled us to achieve many of the things that we wouldn't have been able to achieve in any other way. And thank you also that Open Society Foundations didn't in any way try and direct our work or stipulate how we should do our work and what we should be addressing. Looking to the future, we want to build on our past work. We look forward to a world where people most of the time can make well-informed, conscious decisions about their behavior, their bodies, what drugs they do or don't take, and not live in fear of being criminalized, stigmatized or excluded because of that. But what we really need now is a few sources of funding that give us the freedom to keep doing what we are doing, to form a non-partisan organization to work on drug policy and related policies, because drug policy doesn't happen in isolation. And if we can get the right funding, we will be able to take this regionally and probably continentally, because the way we work is to give people the independence that they need, and we trust them just like the funders trust us, and we make sure that whatever we do is working towards meaningful change within the communities and society that we live in. Well, we'd be very excited to hear from people, especially if you're interested in providing some of this catalytic type of funding, but even if you just want to talk about it, please contact me at Shaun, S-H-A-U-N, at TB HIV Care.org.